Hi, everyone. Now, when I was first getting started in practice, diagnostic lab testing was probably the most confusing step of practice setup for me. I had to figure out which labs I wanted to offer in my clinic. Then I had to set up accounts with those specialty labs, really weighing what would be most applicable for my patient population, what's most affordable, who has great customer service, et cetera. Then I had to set up an account with my hospital lab, local hospital, for the routine blood work. And really, I'd been exposed to some labs from my attending physicians when I was in naturopathic school. But when I started to attend conferences and learn just how many different functional companies were out there, it felt complicated. It was confusing, it was complicated, and really, how to interpret every single test that I wanted to run was like an entire another level of schooling. I've heard this also from some of our most experienced clinician customers at Emerson Ecologics and Wellevate and their staff, who, when we would meet with them to see how things were going in their practice and how we could really be a good partner for them, this consistently came up. Managing labs is difficult and time consuming and a piece of admin that they wish we could help solve. Okay, so as a solution focused company, and one with a history of really simplifying processes for your practice, we knew that we had to tackle simplifying diagnostic labs for you. And so we're really excited to share Wellevate Labs with you today. I'm going to take a few minutes to just give you an overview of Wellevate Labs and show you how you actually can use it. And so if you're a current Wellevate customer, if you have lab ordering capability, you can actually access this right now in your platform. You could open another screen and do this alongside me if you want to. And if you are not on Wellevate, it's really simple to set up an account. And from there, you'd be able to make supplement recommendations to the platform and also handle Wellevate Labs. Okay. So if you have questions that come up, please, again, drop them in the Q&A and I'll do my best to go ahead and be able to respond to them. So why Wellevate Labs? We really know that we want to give clinicians better access to the specialty and conventional labs. Now they're really at your fingertips. You know, it puts labs, lab ordering, your order history, a patient's order history, and all the results in one central location. So now whether you want to order from one functional testing company or 5 for a patient, you can do that all in one place in one order. And we really simplify that on the back end. And then all you have to do is wait for the results to come in. And it's going to be just one, one entry point, one portal where you can view all the results. Someone just said the Wellevate Lab site's not loading right now. Part of that might be because you're running this stream, which actually takes up quite a lot of bandwidth on your computer. So maybe just give it a try afterward. We also have a physician support network. So what that means is we have a physician in all 50 states who actually will co-sign on lab orders for practitioners like dietitians, for example. Or I know, like, even a naturopathic physician, we don't have ordering rights in every single state because not every state is licensed. So we do have a physician support network to support those practitioner types that labs allow to access through a co-signature. So that's all integrated. When you first get started, you would be assigned a physician co-signer, and that applies for all your patients ongoing. We have great support. So you have personalized labs that are tailored to fit your patient's needs. We have Ask the Doctor support that can help you with both choosing labs and lab interpretations. You get instant updates even through text when results are ready. Specialty lab kits, all the logistics get handled on the back end. You don't have to stock them in your office. We handle everything, getting them to your patient and really putting them through and supporting your patient. We offer things like mobile phlebotomy service. So I'll kind of show you a couple of examples, but patients can go to a LabCorp draw center, or we can send a phlebotomist to their location to have blood drawn. So no more pressure on the patient to try to solve that conundrum themselves. We'll have our phlebotomist schedule directly with your patient. And all their patient results get put into your portal. Really, really cool. And everything's really integrated. So you can serve your patients in record time. You can build custom protocols and custom lab panels. You can schedule appointments within Wellevate in a HIPAA compliant telehealth platform. So we're really putting everything in one place to make it super easy for you. So what's available through Wellevate Labs? We have about 1,300 labs offered by LabCorp. It's their full suite of testing through serum or anything that doesn't need to be collected in office, such as a pap smear. We don't offer those, but all the blood work testing that they could go to the draw center to have completed. And then we have a variety of lab partners. You can see them listed here. The only one that's not listed here is Boston Heart, which was a recent addition since we built out the presentation. They just joined us as well. So if you like Boston Heart's testing, they're there as well. But probably a lot of the labs that you're utilizing today, if you're doing functional medicine testing, and actually pretty much everything that was talked about in our presentations so far today. Ordering labs is really quick and easy. So let me just show you how to do that. So when you log into Wellevate, what you'll see is on your main dashboard, after you log in as a practitioner, you'll see this button that says Launch Labs. If you don't see it right away, try clearing your cache, and then it may load. Okay, so sometimes you need to just clear that and kind of reset your login. Once you hit Launch Labs, you will be launched into our lab portal. And from here, you can do a couple of different things. You can put lab orders in, which I'll show to you. You can view all the lab results that have come in. You can request support if you have questions about lab testing, whether it's about which test to order or about results. You can submit a support request. And then additionally, you can view the entire test menu here. So when you click lab order, the first thing you'll do is select your patient. Now, if you're utilizing Wellevate currently with your patients and you're sending recommendations, all of your patients that you've built into Wellevate automatically are ported over into Wellevate Labs so that you are able to order for them without starting from scratch with a patient. You don't need to rebuild your patient files. We have a lot of their information on file already, their name, their address, their email address, things like that. So what you would do is you would use the search to search for your patient by last name or date of birth, click submit. And if it is a new patient, we will collect their date of birth because that's one thing we've never asked for before. So you'll update their information. And once you do that once, we're all set. Once you select the patient, you'll go ahead and click add new lab order here. Down below, you can also view the order history for patients, what they paid for, the status of everything that you've ordered, etc. So when you go to order testing, the first thing you'll do is pick a type of testing. The conventional labs are located here. These are the LabCorp test labs, and then specialty labs are all of the functional testing companies that I've just showed you. These are handled a little bit differently. Conventional lab tests, everything's electronic. So when you build an order for your patient and you hit submit, we will contact the patient to collect payment from the patient. And then when that happens, we electronically submit the requisition form to LabCorp on your behalf. We also send a link to a patient where they can log into the portal to download their own copy of the requisition form. That way they could have a paper copy to walk in with as well. Let's go ahead and do that first. So conventional lab testing, if you select this here, the next thing you'll be asked is what type of phlebotomy. If you collect in your office, maybe you have a team member who does this for you, you'd select in-office collection. If you select draw center, a pop-up will show up that invites you to put in a zip code, and you can help your patient find the local draw center. And then a $7 charge or maybe $10 charge is added to the order, which covers the cost of the lab draw. And then we also offer mobile phlebotomy. This is across the country, no matter where you are. We have companies that service our customers and patients everywhere. And then we would contact the patient after they put the payment through in order to have a phlebotomist come to them at a convenient location. So for this sake, let's just say it was an in-office collection. At that point, you'll be dropped onto the screen to choose your testing. You can click add a LabCorp test to order, and I typically recommend using the search box here. When I search progesterone, you can see all the different forms that get added. And then all you have to do is hit the plus sign and it adds it to the order here, and it starts to generate the patient's lab order. If you find tests that you're using a lot, you can click the star and that will add them to your favorites, which bumps them up to the top here. So right when you click here next time, all of your favorites would be there to view. I'm not going to walk you through the details, but you also can create your own custom panels here. So if you wanted to go in and you'll see this with like Jim Laval later this afternoon. He has standard panels he runs on his patients. I'm sure Mark Hyman as well. He referenced that too. So you could build a panel that might be the wellness panel that you check on everyone. And you can always edit it per patient, but it allows you to add a lot of tests with one button rather than having to add them each time over and over again. Now, as soon as you complete the test list, you would just hit submit order. It's really that easy. Now, if you want to run on the specialty lab side, you would start here by clicking specialty labs. Here, you'll see a list of all of the different companies that we offer, and you would start by selecting the company. Here you can see precision analytical. And then a drop down will open up with all of their testing. So let's say I wanted to run the Dutch cycle map. I would, again, just click the plus sign here and it would add into the cart or into the order. And then if I wanted to add another test, maybe a Genova Nutraval, again, I would just click on the Genova name, find the test I want, or you can use the search bar on the upper right corner. And then again, just hit the plus sign and it adds it to cart. So you can order across multiple companies in a single order for a patient, which means you only order once, the patient only pays once, and we handle all the logistics on the back end. From here, you can just review the order, and then as soon as you're ready, you would just agree to the terms, click the orange button that says place order, and we handle the rest. Then you really just sit back and wait. The test kits get shipped to the patient. If it's required, the patient completes the test, sends it back in per the lab's instructions. The lab takes a week or so to process the order, and then we put the results right back into this results section of the portal for you. This is a demo account, so you can see there's no results listed, but all of your latest lab results would be listed here, and you could search for your patient's result as well. So let me go ahead and take the questions that have come up here. So, okay, so someone asked, is there a way for practitioners to prepay? Not at this time. Right now, we're on our first MVP launch, and we're so excited about what we have out here. That is something that we've considered for the future. So it's on our list of further development. So stay tuned, and something that we may be able to offer in the future. Okay. Someone asked about integration of lab results into EHRs. So Wellevate is integrated into several EHRs where when you're in your EHR, you can make a recommendation of supplements and the order will flow through into Wellevate and we help the patient fulfill that recommendation for you. With labs, again, we just are launching the basics for the platform, but it is something that we have on our radar to make it easier for you as well with that type of integration. Okay, for patients who require a phlebotomist appointment, is that something that's covered by insurance? At this point in time, the platform does not engage with insurance. There's a couple of reasons for this. One is that, again, this is our MVP launch. We're really starting with version 1, and it's something that we'll continue to iterate on as time goes forward. The second thing is we want to really simplify it for you and for your patients. When you go into Wellevate Labs, if you look particularly on the LabCorp side, which are the ones that would normally be insurance covered, you'll see the pricing here is extremely competitive, lower than I've seen, in my own practice experience and from the clinicians that I know. Very good cash pay pricing. So this is especially great for patients who may have high deductible insurance plans, which are so common, where they can prepay for those labs and then keep the receipt to file with their insurance after the fact. Okay, someone asked about adding a group of patients. Like I said, any patients in Wellevate are ported over into Wellevate Labs. Every time you log into Labs, that gets updated. So if you wanted to input or bulk upload patients into for Wellevate Labs, all you have to do is bulk upload them into Wellevate. And we do have the ability to upload a CSV file, and we can convert that into those individual accounts for your patients at that point in time. If you need help with that, our customer support team is extremely experienced, and you can even just email them the file and they'll take care of the rest. Or we use an upload system that's HIPAA compliant. So I guess not directly email, but we can help you with all of that. And let's see. Is there a markup on the patient price to cover the service? Great question. So the pricing within Wellevate Labs is really the practitioner pricing. It's the best that the labs make available. There is a 5% service fee for use of the platform, which the patient pays. But otherwise, it's the best price available, that practitioner price that you might see a lab advertising. Similarly, with LabCorp, it's the lowest pricing available. It's like similar to Medicare, Medicaid rates, extremely low. There's a 5% service fee. We don't make money really on this platform. It's really here because we want to make this service fully available to you. Okay. How does pricing compare with going directly to the labs? Again, the pricing would be the same pricing that's offered by the labs, except that a 5% service fee gets added to the total transaction there. And if a patient has questions about collection, who do they call? So that's the nice thing. They'll get all the support to call us. and we could provide the support to them across any types of lab tests that you order. So we're really very, very excited about this, and I thank you guys so much for for being here and being able to let me show you what we can do now for you. So we do have our next presentation. I don't know, did we have Eric? Is Eric here? I know we had Eric from Holistic Primary Care jumping in.
Here, can you hear me, see me?
I think this is
Hello,
him.
everybody. Yeah, this is me.
Wonderful. Great. I'm so glad I wasn't able to connect with you right before this session because we were hopping straight in. So I'm glad it all worked out.
Yeah, it all worked. It's lovely when it works, isn't it?
This is Eric Goldman, Editor-in-Chief of Holistic Primary Care, probably a publication that many of you count on and love to learn more about integrative medicine and about what's happening in the industry. So thank you so much for joining today.
Well, thank you for having me, Jaclyn. It's great to be here, and I'm totally knocked out by the conference so far. I mean, really great, interesting, informative presentations, and I'm equally knocked out by the Wellevate Labs program. I mean, you've really pulled together so much in a very coherent way that I think is going to make a difference in a lot of people's practices.
Thank you.
So I was wondering if you could tell us a little bit about how this evolved. I mean, we think of Emerson and Wellevate as kind of, supplement distribution solution. This is a pretty new thing. So how did it all come about?
It is, yeah. So, Wellevate, well, Emerson did start with dietary supplement distribution, like you said, really helping practitioners stock their dispensary across multiple brands. And that was the case for, decades, really, of what we were known for. And we really tried to rethink, what Wellevate and how Emerson can be of better service to our customers. And really, we really view ourselves as we want to make practice easier, less complex, and a lot more fun, and let practitioners focus on the things that they really love to do, which is the clinical learning and then the application of what they learn to help their patients. In fact, probably the top key performance indicator, KPI, that we monitor as a company is patient lives improved, right? So that's a number that we report on every single day across the company to how many patients' lives we were able to assist practitioners in improving. So labs were really a natural evolution for us to include this, because when we think about what doctors need and where we might still be able to simplify, the lab world is one of the more challenging admin pieces still. And so for us to really be able to help streamline that, we think can really make a big improvement in practice. I mean, Dr. Hyman referenced how diagnostics are just so critical to the personalized care that we provide as integrative healthcare providers. And we really agree. We want to make it easier for practitioners to do that. And we want practitioners to have streamlined access to the conventional and the specialty lab testing.
Great. Now, what is the implementation time on this? Let's say I'm a brand new practitioner. I haven't used Wellevate at all before. Like, this is all new to me. How long before I'm able to go on Monday morning?
It's very quick. So the Wellevate account setup probably takes 2 minutes. And then once you are logged into Wellevate, our team will approve your credential. That's like one kind of pending step. You can still see the labs, but you won't be able to order them until we approve your credential. And then when you click on Wellevate Labs, we will ask for your NPI number, which is your National Provider Index number, and you essentially sign a different kind of waiver form. After that, you're let in, and you can get the ball rolling. So literally probably under 5 minutes if you were brand new to Wellevate, to open the Wellevate account, connect over to Wellevate Labs, and put your first order in for a patient. It's extremely fast.
Wow. So under 5 minutes, you're saying?
Yep.
That's pretty impressive. Now let's talk about qualifications. Who can, who can't use it? How does that all go?
Great. So there's kind of 2 categories of providers. So if you have lab ordering rights per your license, you would be allowed right into the platform and have those lab ordering rights. A lot of lab companies on the functional side also recognize the importance of functional lab testing for providers who aren't typically licensed to order testing, because from a licensing and regulatory perspective, they license practitioners to order testing if they're allowed to diagnose, right? And they think about lab testing as leading to a diagnosis. So physicians who diagnose would need access to labs, whereas conventionally, maybe a dietitian who is not diagnosing wouldn't traditionally utilize labs. But we know in the functional testing world, things are different because we use these to inform really the why and the how behind the diagnosis. So there are a group of practitioners such as dietitians, pharmacists, those that labs have allowed access to. In that case, they require physician co-signature. And so we do that all on the back end. It's a really seamless process. It's not like you have to place a phone call or get any kind of a personalized approval on a per patient basis. But when you set up the account, we link you with a physician co-signer who will kind of behind the scenes help to facilitate your tests and make sure that when things are coming back, there's nothing that would be a red flag that would require a physician intervention.
Now, I'm in New York City, New York State, and this is a state where there's a lot of restrictions on what physicians, even medical doctors, can and can't order, especially about the functional testing, functional medicine testing. Is the Wellevate platform geographically agnostic, or do all those restrictions still apply?
We wish we could be, but they still apply because that's actually like state regulations and state law. So there's not any way to get around it, although we absolutely wish we could service you and hope that in the future we'll be able to.
Yeah, well, I think that's a political battle. I don't think anybody's even started fighting yet.
Yeah.
Not recently, anyway. So tell us a little bit more about which lab companies and tests are available and what's going to be coming in the future.
Sure. So, I mentioned LabCorp is the provider that we have for the conventional testing. So this would be like a CBC or a comprehensive metabolic panel or the thyroid panels that a lot of practitioners have referenced. There is a lot of testing in there. And in fact, that's a great way to get a wide variety of tests done for a low amount of money. So you can access basically everything that you can imagine ordering through LabCorp, we have on the panel. And then from the functional testing side, we have a variety of companies. We have 16 functional testing companies. I can actually pull this slide up again so we can kind of view it as we go through, but get back towards the beginning here. We've got a lot of the ones that you're probably familiar with already. For example, Genova, which offers a wide variety of testing across pretty much every category of lab testing. Doctors Data, SpectraCell is really well known for their nutrient testing. Precision Analytical, who you heard from today, very unique type of testing with salivary and urine testing for hormones and hormone metabolites. US Biotech, another company that does a lot of food allergy testing as well as hormonal testing. Diagnostic Solutions Lab, their key test is the GI map, which a lot of people have heard of. That's the PCR test that Dr. Tito was referring to that she utilizes in practice, and they also have a couple genomic testing. And you can see a wide variety here. So we cover really hormonal testing, GI testing, toxicity testing, food allergy testing, genetic testing, and 3x4 Genetics is a company that just added on with us as well that has some really clinically relevant SNP panels that, if you've not been, exposed to this company before, it's worth looking at. One thing that's great about all these functional testing companies, and if you're a conventional provider new to functional testing companies, is that the reports are amazing and they're so informative, and the way they lay them out, you can learn so much about a patient that goes way beyond just a list of numbers being high or low. So that's something that I would definitely explore.
Let's talk about that reporting piece a little bit more, because you didn't really get into that in detail when you gave your presentation. What happens once the labs are done? Where does the information go? What does the patient get to see? What does the practitioner get to see? How do you facilitate that relationship?
Great. So this is the lab's dashboard, and you could click on this lab results section, which is in the header bar, as well as in your quick links. And then from there, you would view, right here, again, this is just a demo account, so you're not seeing any real results come through, but you would see the patient and the test linked here. When you click on that, for all of the functional testing companies, you would receive the PDF of the report from the patient. With LabCorp, we can provide the PDF, but it's really more of a data flow where it's in a chart with the specific lab, the test results, and the normal range. And you can view that all here. So the practitioner gets notified when the test results enter the platform or the portal. The practitioner has a toggle switch where they can turn it on to create access for their patient within the patient login. But the practitioner gets the first view and they decide whether they want to release them to the patient. Or some practitioners I know don't want the patient to view it on the portal. They would rather have the patient schedule a visit and come in where they can receive a printed paper copy. So we allow the practitioner to handle that any way they prefer.
So tell us a little bit more about this patient portal, because it seems like that's a very integral piece in just facilitating the ongoing relationship between practitioners and patients, which we know is such an important piece of the overall outcome.
Absolutely, and I'm sorry I didn't do screen capture here. And with the platform we're using today, a screen share is a little bit tricky on the bandwidth, which is why I kind of took some screen grabs here. But there's really two. With the lab side, the patient portal is very simple. They literally log in and they'll be directed to orders that require payment. And then they have their results button that they can view. It's very, very simple. They can view their past orders. They can view their lab tests. But the more robust patient portal is actually within the Wellevate platform, where patients have access to all of the care plans that you've put in for them, all of the supplements that you've built in with the doses you prefer. You can upload handouts for them, etc. And that's all within the Wellevate, kind of, I would call it their recommendation portal. Now that's pretty cool. And we also have a patient-facing app with Wellevate. So if you're using Wellevate, we highly encourage you to get your patients on the app. It increases compliance. We've measured this. And it's really easy. We've got a lot of tools where you could have, for example, a poster with a QR code in your office that they scan to download the app to make it super easy. But within the app for Wellevate, patients can view your recommendations. They can order products with a click of a button. We also have a barcode scanner for reordering. So if they don't have the products built into the app, when they're looking in their cabinet, I happen to have some supplements right here. When they go to their cabinet to refill what's low, they can take the bottle, use their iPhone camera, have one of those right here too, to scan the barcode, and we add it to their cart for them. So it makes reordering really simple. And actually, we've had patients that have maybe bought like a protein powder from Whole Foods, and they can scan that and see if we carry it in Wellevate so they can get it through their doctor rather than buying it through retail, which a lot of them are incented to do because they can get a little bit of a discount typically from their practitioner. We also have, now we're starting to collect data from patients in the app too. So when patients log into the Wellevate app, we do a quick question check-in where they tell us how they're doing with their symptoms and whether or not they've taken their supplements that day. And that's so that we can quickly provide that information to practitioners. So before a patient visit, the idea is that you'd be able to take a quick flash in the Wellevate portal and just get a quick check on what's going on with your patient before they even walk in the door.
Wow, that's super cool. So if a patient orders on her own or his own the supplements, the doctor gets informed about that?
They can view that in their account. We don't tell them every single time because there's so many orders that it's a lot of notifications. The practitioner can set it up if they want all those notifications. But when they log in, they can view all of their activity across all of their patients within their Wellevate dashboard. It's pretty amazing. We also will show practitioners if their patient was due to refill and didn't refill, or if they sent an order to a patient and the patient never fulfilled it. Those are highlighted so that the practitioner themselves or their staff person would know to make a phone call outreach to make sure things are okay.
And if I'm right, you said that Wellevate is handling all the customer support. So if patients have difficulties or questions or whatever, they go to Wellevate, not to the doctor. Is that correct?
That's right. Yeah, we have an incredible customer support team. And so there are some questions around like treatment that we would have to say, please call your doctor. But if it's about a question about the product or about how to take it, we can see the doctor's instructions to reinforce that. Or a question about their order or shipping or anything, we would handle that for them.
It's really terrific, and it's totally on trend in terms of how how telemedicine is, I mean, COVID drove it to the forefront, but I think it's going to become the norm of practice all across the board, both in conventional medicine as well as in functional medicine. And so this piece dovetails right in there very, very well.
Yes, we're really excited. And we also have a telemedicine functionality within Wellevate as well for practitioners who want to use something that's also HIPAA compliant. So, well, yeah, thank you so much, Eric, for being here with us today. And where can people kind of learn more about how to get connected with holistic primary care to be a subscriber?
Oh, sure, yeah. Just go to www.holisticprimarycare.net, and we're always posting new and interesting stuff there. You can sign up there for our free monthly email newsletter, which is called Upshots, and there is a button for subscribing to the actual print publication, which looks like this. I'm sure many of you have seen it at conferences over the years. We've been at this for a little while, just about 21 years now. And we're excited to keep going. I mean, I think all of this, natural medicine, functional medicine, is really on the brink of major, major expansion in the years to come, and I'm excited to be part of it. So thanks for having us, and we look forward to working with you.
Thank you. Thank you guys so much.